Hello everyone, and welcome to Marana Global Services Limited. In this short presentation, we'll be talking about occupational health and safety hazard identification and documentation. My name is Olayinka Fashuse. I am a trainer with Marana Global. Marana Global is an occupational health and safety organization. We provide safety trainings and certification in partnership with the Institute of Safety Professionals of Nigeria, and I am glad to let you know that in Nigeria we are the authorized training provider for this institute. This is the institute that regulates professional safety practice in this country, and we are glad to be their main partners in this industry. In this occupational health and safety hazard identification and documentation discussion, our objective is to promote knowledge of workplace hazards and contribute to OSH improvements through effective hazard identification and documentation. This is very important because as a professional, as a worker in the industry, you want to know which hazard are you exposed to, what's your risk, and then how you can control this. Doing this requires an effective hazard identification and documentation procedure. The scope of this short presentation is the identification of hazards. We'll be talking of various means by which hazards in our workplaces can be identified, and then we'll also cover documentation of these hazards using a template that we'll be looking at later in this presentation. Why is this course important? The ability to identify hazards is key to the success of any health and safety program at work. The documentation will also help in designing targeted control measures. You've had your hazard identified, and then you can target your control measures, and you can prioritize your control actions based on these identified hazards. And this will help in other applications in our workplaces, including your job hazard analysis and incident investigation. You can have an accident recorded in your workplace. Having your hazard register, having your hazard identification will help you to effectively prepare your incident investigation and conduct the process in a seamless way that is more effective and cost saving. So, let's look at the definition of hazard. Generally, from the industry, we know that hazard is anything that has potential to cause harm. This is a widely accepted definition of hazard, and it's very popular. It's consistent with industry use, and it's consistent with definition of ISO 45001 for occupational health and safety management. Note that this incident that causes harm in the workplace may not be hazards themselves, because the incidents arise due to the presence of a hazard. So when there is an incident, what causes the incident is what we should identify as a hazard, and not the incident itself. Every hazard, every workplace has hazards, and it's important for us to have this conception, to have this mindset. When we are working, we should know that there are hazards in our work environment, and they can be found anywhere and anywhere in the workplace. Regardless of where you're working, regardless of when you're working or how you're working, there are always hazards that you want to talk about. There are examples of hazards. Here we have some examples of hazards that we can talk about. We have wet or slippery floor, which is a hazard at work, even at home. We have poorly kept workstation. That's talking about poor housekeeping. We have poor workplace design, talking about ergonomic concerns. We have inadequate lighting. We have inadequate ventilation, faulty or defective tools, hydrochloric acid, asbestos dust, and a lot of other hazards. Hazards cannot be exhausted when it comes to naming them. What we want to do here is to discuss how to identify or recognize these hazards so that whatever form they present themselves, it will be easy for you to identify them and then put controls to improve your workplace. All hazards can be categorized into these 5 categories. 1. Chemical hazards. 2. Biological hazards. Physical hazards. Ergonomic hazards. And number 5, psychosocial hazards. Details of this will come during this presentation, in the later part of this presentation, especially when we're talking of hazard documentation. We'll look at details of this. But just in a summary, chemical hazards are those hazards originating from chemical origins, coming from chemical origins. For example, you have your sulfuric acid, which is a chemical, and that's an example of chemical hazards under the chemical category. You have biological hazards, which will include the viruses, bacteria, insects, and so on and so forth. The COVID-19 we're talking about now is caused by a biological hazard. Physical and mechanical hazards. This will talk about your physical workplace design, conditions, the environment, and so on and so forth. So we'll be talking of things like uneven floor, wet floor, unguarded equipment, moving equipment, and so on and so forth, moving vehicles. These are all physical and mechanical hazards. A lot of examples can be named depending on where you work. Ergonomic hazards, we'll talk about hazards relating to the work design itself. Ergonomics has been designed as the scientific study of the relationship between the worker and the work itself. Examples could be your workplace design in terms of space requirements, in terms of your physical ability to do the job, in terms of your seating arrangement, in terms of your work computers, your laptops, your desktop, and so on and so forth. How you interact with this is what we'll be talking about under ergonomic hazards. And lastly, psychosocial hazards are those hazards that affect a worker mentally, the ability to reason, the ability to judge, the ability to concentrate, emotional disturbances, emotional effects. What we'll talk about when we're talking of psychosocial hazards. So, hazard identification. When you want to identify hazards, there are 2 things that we need to consider. First, you need to ask yourself, what can go wrong? That is, you're looking at what incidents can arise in this process, in this system, in this activity, in this task we're doing. The second one is, what can make it go wrong? Now, you have an incident that has been anticipated. Something must be responsible, something must occur, something must cause the incident to go wrong. For the incident to occur, there are things that must interplay at the background. There are things that must exist at the background, and these are what we call the hazards. So, for the incident to occur, the hazards are what will be responsible. So, when you're looking at identifying your hazards, you look at, of course, the incidents. You have an idea of the incidents that may happen. Then, what will be responsible are the hazards that you now have to identify so that the incidents will be prevented. There are some ways by which hazards can be identified at work. You can carry out inspections, either general inspections, work around inspections, special inspections, depending on the inspection you're carrying out. These are good ways to identify hazards. You have a worker that is carrying out a task. You can look at how the worker is doing the task, make observations, and check if there are things that the worker is not doing well, if the environment has posed a risk to the worker, and so on and so forth. These are things that you can spot out during inspections, and then you can pick out relevant hazards. General or special audit is another way that hazards can be identified. Reviewing accident history is another way. Of course, every organization will always have history, or depending on the type of activities or operations they are engaged in. When there is an accident history in an organization, it can be reviewed. The lessons learned can be looked at, the recommendations can be looked at, the factors, the causes of the accidents can be looked at, and so on and so forth. And this can be a good way to point out accidents, to point out hazards that can help us to improve the present work situations. So we have the job hazard analysis, what some of us call the job safety analysis, the task safety analysis, depending on what you call it. What we're talking about is analyzing the hazards in your work. And doing this, if you have an effective JHA that has been done for a task, this is going to be a comprehensive document that captures every hazard possible in that task. And if you have such a document, you can go back to it, review it, knowing that this JHA was designed for your organization, for your task in that organization. It also covers your people, your processes, your equipment, and so on and so forth. So doing a review of this JHA will be a quick way to find out hazards in your workplace. Brainstorming among the team members is also very important. You have a team that has been assigned to do a particular task. They can sit together, they can discuss among themselves, they can brainstorm, they can criticize, they can express their concerns. At the end of the day, hazards will be pointed out and the work process itself will be improved. Consulting material safety data sheet. MSDS is a document that accompanies every hazardous material you have to deal with in your workplace, and it's a legal requirement for you to have a material safety data sheet accompanying your hazardous material, such as chemicals, such as paints, which are various types of chemicals, for instance. These are very important. It's part of product stewardship, and the MSDS contains very, very vital information regarding the safety of the hazardous materials you are looking at. You're handling a material that is, for instance, explosive. Vital information will be provided in MSDS on how explosion will be prevented, on how harm will be prevented, and a lot of things you can learn, a lot of things you can do based on recommendations of the MSDS. So looking at that, the hazards can also be identified. Consulting equipment manuals from original equipment manufacturers is a very good way, because they make the equipment, they make the tools you're using, they know the potential failures that can arise, and they know the failure mechanisms that you can talk about. So looking at their recommendations and looking at the hazards they've pointed out, how to troubleshoot, how to manage, how to use, and so on and so forth. These are very good ways to make sure that the hazards in this equipment are being controlled and properly managed. So looking at the equipment manufacturer's manual is a good way to identify hazards when handling such equipment. So from this slide now, having talked about the hazard identification, we now have to move to documentation of these hazards. Before we do that, we'll just take a recap. We've talked about definition of hazard. We said anything that has potential to cause harm is a hazard. And we'll give you some examples. I will let us, on our own way, based on our environment, give different examples that we can think about as hazards, and see how these hazards can cause an incident, and look at the chain of events generally. We've talked about hazard categories. We said we have 5 hazard categories, including the chemical hazard, including the biological hazard, including the physical and mechanical hazard, including the ergonomic hazard, and the last one, the psychosocial hazard. And we said we can identify hazards by carrying out inspections, by carrying out audits, by carrying out reviewing of accident history, by reviewing job hazard analysis for previous jobs, by brainstorming among the team members, by looking at the material safety data sheet, by also consulting the equipment manufacturer's manual. These are ways by which we can identify hazards in our workplace. Now, let's move on to documentation of these hazards that we have identified. This document we have is not too clear because it's actually big. The screen is not enough to display it clearly. I recommend that you go to our website, go to www.maranaglobal.com. At maranaglobal.com, you go to templates, go to the download section, beg your pardon. Under the download section, you see templates, click on hazard register. Download the hazard register, and then that is the same thing we have on this document. So the hazard register is what we use for a hazard documentation, and this is a requirement for every organization because it's a law, or it's a legal obligation, I would say. Various international conventions has provisions that employers must identify hazards and communicate these hazards to the employee. You have the right to know, and the hazard register and documentation is a way to meet these obligations. As you can see on the screen, this hazard documentation uses a table which we call hazard register. This hazard register was designed by Marana Global Services Limited, and we've had some organizations use this to improve their OSH procedures and get the workplace better generally. It is based on the 5 hazard categories we've talked about before, which include the chemical hazard, the number 2, the physical and mechanical hazard, number 3, the biological hazard, then number 4, ergonomic hazard, and number 5, psychosocial hazard. These are the 5 hazard categories we have. That is the first column in the table. The second column talks about recognized hazard. And recognized hazard by OSHA definition is any hazard that the employer has knowledge of, either by special technical procedures, either by general observation, whatever means you're using. The fact is, you know that this hazard exists in your workplace, and then it becomes a recognized hazard. So the hazard that you've identified in your workplace are recognized hazard. The third column, I believe you're looking at your own template downloaded from maranaglobal.com. The third column on the template is route of exposure. Now, for this hazard to have effects on the worker must be exposed. So the route of exposure is talking about how or what are the means by which the worker can be exposed to this hazard. The first under route of exposure is direct contact or impact. The second is by inhalation. Inhalation is when a worker takes in a hazardous material through the lungs. The third one is ingestion. Ingestion is swallowing a hazardous material, that is through the mouth. The fourth one is injection, that is what we call intravenous exposure, when someone injects a hazard through the skin, through the veins. The next one is radiation. Of course, we've been talking about radiation hazard, especially with connection to the 5G network. And lastly, on the route of exposure is psychological exposure. A worker can be exposed to hazard psychologically if such a hazard will affect the way the worker thinks, the way they make decisions. If it can affect them emotionally, then we'll talk about psychosocial exposure. So these are the various ways we can talk about hazard exposure based on this hazard register template. First, we said direct contact and impact. Then the next is inhalation. The next is ingestion. The next is injection. The next is radiation, and the next is psychological exposure. After the exposure, Then you've known how the worker can be exposed to the hazard you've identified. The next thing you should do is to take action to control these hazards. Now, actions can be in two forms: the ones you've already taken and the ones you will take. So the ones you've already taken is what we call executed under this table. Under the table, the next column after rate of exposure is executed. Executed is talking about the actions your organization has taken to control the hazard. Okay. After the executed action, then we should actually have status. Status, which talks about whether the action you've taken has controlled the hazard totally or whether it is requiring a follow-up. Now, an action can be, for instance, it can be adequate or it may not be adequate. What we are trying to talk about here is not to see whether the action is adequate or not. You've stated the action taken. The status is whether the action has been closed or whether it is ongoing. This is very important. And after the status, you have your recommendations. Recommendations, we now here talk about what are the follow-up actions, what are the further actions required for the actions you've taken. You might have taken an action and then there will be an improvement need, or there will be a need to follow up on that action, or there will be a need to make it a continuous action, and so on and so forth. And as a best practice in the industry, continuous improvement is a good deal for us, especially if you are ISO certified. Even if you are not certified, continuous improvement is a good deal. And then we want to confirm that recommendations will always come to your organization, regardless of the actions, regardless of how beautiful you've done in the past. You will always have an opportunity for improvement. And these recommendations can also have timelines. That is where the dates will actually come in. Date for the recommended actions can follow, and then who is responsible, that is the action party, can also follow. So just for illustration's sake, we're going to take one hazard under each hazard category, look at how we implement them using this table, and so on and so forth. Okay, so we have under chemical hazard category, we can take the first one, sulfuric acid. That is the recognized hazard. Then route of exposure, how can the workers be exposed to sulfuric acid? By direct contact, we have to tick that. By inhalation, you can inhale the sulfuric acid, we have to tick that. By ingestion, accidentally someone can take in sulfuric acid, we have to tick that. These are ways by which sulfuric acid can be exposed to workers. Executed actions could include, for instance, your organization may have things like good housekeeping is practiced in the lab. If we're talking of a laboratory, that could be an action. Then personnel are trained on handling hazardous materials. This could also be an action that your organization has taken. What is the status? The first action, good housekeeping is practiced in the lab. The status should be ongoing, because good housekeeping is not something that you do and you stop. It has to be a continuous action, and then your organization should be able to keep it up. So the status is ongoing. The second action under executed is personnel are trained on handling hazardous material. This could be a closed. When you are looking at status could be closed because training has durations, and after completing a particular training, you can be required to close it out. So status for training should be closed if the training has been completed. Recommendations for sulfuric acid, managing sulfuric acid: always use adequate personal protective equipment during operation. Now, this is a good one regardless of what your company is doing or has done, regardless of experience and training. PPE is always required when you're handling things like sulfuric acid. So this is a good reminder as a recommendation that you should always use it. Only competent personnel should handle sulfuric acid. This is also a good recommendation. We know that risk will increase when you are using less competent workers to handle hazardous tasks. So the more competent, the lower the risk. Review personnel training. Of course, you said the personnel have been trained under your executed action. It is also important as a recommendation to review their training to see whether the training is still adequate and relevant to the present day situation, and so on and so forth. There could be a lot of recommendations based on your detailed analysis. The date for the recommendation, of course, should be stated, because recommendation should be time bound. It could be 2 weeks, it could be 3 weeks, it could be 4 weeks, it could be 5 weeks. You could quote exactly the number of days required. You could also state the particular date for the recommendation to be closed out. Who is responsible? That is the last one. The action party could be the lab supervisor, it could be the HSC personnel, it could be a joint responsibility. The lab supervisor is to oversee implementation of these recommendations, while the HS personnel will do a follow-up to see if the recommendations have been closed out and to see if there are challenges for the closeout of those recommendations. Now let's move to the second hazard category. We'll be talking about physical and mechanical hazard. That's the second one. Let's pick a hazard under this. Under identified hazard, we'll pick, say, uneven floor. Okay, we can pick an uneven floor. That is a recognized hazard. The route of exposure. How can the worker be exposed to uneven floor? The worker will be exposed by direct contact. So we are taking direct contact under the route of exposure. Of course, the worker will not be exposed to uneven floor by inhalation. The worker will not be exposed by injection. The worker will not be exposed by ingestion. The worker will not be exposed by radiation. And the worker will not be exposed by psychological exposure. So these are very important for us to understand. So under uneven floor, the only applicable one is direct contact. The worker can come in contact with an uneven floor. What are the executed actions? Personnel have been trained and inducted to increase safety awareness. Of course, safety induction is part of the hiring procedure and is part of job execution on daily basis. We have our pep talks, we have safety meetings, and so on and so forth. These are avenues to increase safety awareness and make the workers know their environment and how to work safe in the environment. So that's a good one. There is a plan for visitors to be inducted. Now, your workers may know well how your environment is and the nature of the hazards present. Your visitors may not know, and this is why it's important to have an induction plan to make sure that every visitor in your workplace is inducted. What is the status? That's the next one we'll talk about. The status for the first one, personnel have been inducted and trained. The status should be ongoing because induction is an ongoing exercise in the workplace. Your job could change at any time. Your task could be modified, whatever it is. When these changes come, an induction must be carried out for the workers. Also for the personnel, because you don't limit the number of visitors you have, you will always have visitors, and the induction for visitors will also keep ongoing. So we have the status for the two actions as ongoing and ongoing. Recommendations. Recommendation for controlling uneven floor. Continue workplace sensitization to improve safety consciousness. Now, safety consciousness is very important in the workplace, and this also affects the safety culture of the work environment. So, the more you sensitize, the more safety conscious they become, and that's why this is a continuous action. Continue to do it. Put adequate safety signs at strategic points. Now, safety signages are very important at the workplace, and when a worker says it, an information is conveyed, and then the worker can take necessary action based on the signs and what it means in that place. What is the time or what is the date for these actions to be carried out? You also have to state it. For instance, continue workplace sensitization to improve safety consciousness. This should be ongoing, a continuous activity. So there is no specified date for that. As at when needed, you have to do it. Action part C could be maybe the HSC personnel, HSC officer, for instance, who will also carry out inspections of the workplace and see how workers are doing their tasks and so on and so forth. So let's move to the next hazard category. The number 3 is biological hazard. What can we pick under biological hazard? Okay, let's pick a virus. We know that these microorganisms, for instance, viruses and bacteria, these are biological hazards at workplace, and they are very serious. Take, for example, the current coronavirus we're talking about. It's a very deadly one, just like we've seen. It has caused a pandemic globally, and we know that as humanity, as a people, we overcome this. God helping us. So, under biological hazard, we talk about virus and how can a worker be exposed to a virus. A worker can be exposed to a virus by direct contact, just like we see in the case of coronavirus. We say we should maintain social distance so that you will not have direct contact with the virus. Now, virus can also come by inhalation. The virus can be suspended in the air and then you breathe it in. That's inhalation. You can be exposed to it. And that's why you see that people are wearing nose masks to control infection in some cases. If someone coughs around you, the virus can stay in the air for a few minutes before it drops down, according to UNICEF and WHO. In the process, if it's being carried by the air and you breathe it in, that means you've been exposed. Another way is by ingestion. Viruses can also be ingested. Let's say you have your hand contaminated with coronavirus and you touch a piece of food material and you put the material in your mouth and you take it in. Of course, that's going to be a problem. And virus can also be injected. We've had cases where viruses have been injected into people for certain reasons. In the medical profession, this is also a risk. A virus can be injected. So a worker can also be exposed to a virus by injection. Can virus be injected, or can we be exposed to virus by radiation? The answer is no. Can we be exposed to virus through psychological means? The answer is no. So these are the various means by which we can be exposed to virus: by direct contact, by inhalation, by ingestion, and by injection. So what are the actions the organization might be taking or might have taken to control virus in the workplace? There is a safe procedure for handling infectious organisms. This is important because you have a procedure for these organisms like virus. Personnel have been trained on control of substance hazardous to health, that is OSH, and biosafety hazard. Virus is an example of biosafety hazard, and anybody working with viruses must have relevant training. And if your organization has been, if your people have been trained, they will be under the action the organization has taken. A lot of other actions could have been taken, which we cannot list all of them in this material. What is the status? If you have a procedure for your work, the status is closed because the status for your procedure should be ongoing. Even though the procedure has been designed, nature of the hazard will always make the procedure to change. In many cases, from my experiences, you respond to biosafety hazards, you respond to viruses based on the present realities. So even though you have a standard operating procedure, the procedure is subject to instantaneous changes, and this is where experience and competence comes in. We can look at the case of coronavirus, for instance. It is not something that the medical profession is used to. It is not something that the public health professionals are used to. So, when the issue of coronavirus came up, even though they have a standard procedure for managing hazardous organisms, but the uniqueness of this made them to adopt a change in those procedures, and every laboratory and every office, every organization want to look at the best procedure for handling it. So that's why the status should be ongoing. The procedure may be there, but especially because of the hazard you're talking about, the status is ongoing because it's subject to instantaneous review. Now, talking about personnel who have been trained on things like control of substances hazardous to health and biosafety, status can be closed because your course training should have a schedule, and after completing the schedule, then the training is closed. Your biosafety training should have a schedule, and after completing the course curriculum, the training is closed. Now, let's look at recommendations. What are the recommendations that we can talk about under viruses? Number one, it's important that you review and update your laboratory safe operating procedure when necessary. Like the case of coronavirus, it is necessary that every SOPs in the laboratory must be reviewed and updated because they are not definitely adequate to handle coronavirus situations. Another thing that can be recommended is to review and update personnel training. Though personnel have been trained, you should review their training and update where necessary to make sure that those trainings are relevant to realities on ground. Get biosafety cabinets if you have to, depending on the type of biosafety hazards you have in your laboratory, depending on the biosafety level you have in your laboratory or you have in your organization. That will inform you on the type of biosafety cabinet you should get. We have different biosafety cabinet designs based on biosafety levels. When should this be closed out? That is the date. The date should also be stated. For instance, review and update laboratory SOP when necessary. Your reviews based on your documents controlling your organization, maybe annual review, maybe biannual review, for instance. If the review is due, you have to carry out the review. Or alternatively, if there are situations that require immediate review and updating of those procedures, you have to also do that. That's why we say when necessary. And the date for closing out should be stated. So if you have to get something like biosafety cabinets, you can look at based on factors like financial availability and other things the organizations have been are prioritized to do. This can advise you on reasonable time to close out on things like biosafety. And especially when you want to get a biosafety cabinet, you want to look at how serious or how urgent is a hazard that you're talking about and the need to control it. If you have done a risk assessment, you'll be able to prioritize your hazards and look at the ones that needs to be attended to immediately. So after that, we move to another hazard category. That would be ergonomic hazard. Under ergonomic hazard, we can pick poor workplace setup. Poor workplace setup is a hazard under ergonomic concerns. And how can the worker be exposed to poor workplace setup? By direct contact. The worker can come in contact with a poor workplace setup. You're working and you don't have enough space. This will make you to be taking some unhealthy posture, unsafe posture, for instance. So that's direct contact. Of course, a worker cannot inhale a poor workplace setup. A worker cannot inject it. A worker cannot ingest it. Another thing under this is radiation. Of course, because of poor space design, this could increase the radiation hazard depending on the equipment the worker working with. If you don't have enough space, then radiation may become a problem for the worker. And another thing for poor workplace setup, a worker can be exposed psychologically, because just imagine that you've just got into your workplace and you saw early in the morning everywhere is just messed up. The table, the documents, everything is just packed in a particular corner because you don't have enough space to keep them. It puts you off. It makes the job becomes more difficult for you to achieve, and it affects your productivity. And this we are talking of emotional and mental effects on the worker. You're actually happier when you see a workplace that is well organized, well arranged, enough space, and so on and so forth. What are the actions the organization should be taking or should have taken for poor workplace setup? We can look at things like good housekeeping is being practiced. If you have good housekeeping, it will help you to manage your workspace better, even if the workspace is not enough. But housekeeping will help you to maximize the workspace. Regular inspection of workstation should also be one thing that the organization has done to make sure that the workspace is safe and free from other hazards. There are other things that you can do. Now, under the status, the good housekeeping, like we said before, should be ongoing because it's not an exercise that can be terminated as long as operations continues. Then we have regular inspection of workstations. This should also be ongoing under status because inspection is a continuous exercise. What can your organization do to improve? Talking about recommendations, continue to carry out workplace inspection. Conduct personnel survey to identify possible cases of back pain or other work-related concerns. Now, this is important because when you have a poor workplace design, the worker may experience things like back pain, which is a common ergonomic hazard in the workplace. The back pain, for instance, could be because the sitting arrangement is poor, could be because the seat itself is poorly designed, could be because there is no sufficient space for the worker to work, and then you may have to be bending, the worker may have to be turning, the worker may have to do all sorts of things to get the job done. So asking or doing a worker survey, personnel survey, will make you see, okay, do you have this situation, do you have this challenge? And if you have the challenge, then it's an opportunity for improvement. So carrying out this survey is a good recommendation that the workers, the organization can use to improve the safety of the workers. Similarly, your recommendation is time bound. You can state the time or the required time to close out on this. And who is responsible, that's the action party, should also be stated. Who carries out the inspection? Is it the supervisor or the team supervisor, the line supervisor, as the case may be, or is it the the HSE personnel, as the case may be. Then lastly, we'll talk of psychosocial hazard. That's the last hazard category we have, psychosocial hazard. And there are a lot of hazards that we can identify in our workplaces under psychosocial hazard. Forgive me. Some of these could include aggressive manager. Some of these could include sexual harassment. Some of these could include egocentrism, insubordination, excessive workload, and so on and so forth. Now, an aggressive manager is a psychosocial hazard, and the personnel can be exposed by direct contact. You can come in contact directly with an aggressive manager, and then you can have a physical assault, for instance. Another way by which a worker can be exposed to psychosocial hazard, aggressive manager, is by psychological means. Because your boss is aggressive, it affects your productivity, it affects your thinking, affects your judgment, affects your concentration at work. So these are the two ways by which a worker can be exposed to aggressive manager: by direct contact and by psychosocial, by psychological means. What can your organization be doing to manage this? For instance, you may have a good policy in place that helps to manage workers now, I mean to say, the superior and subordinate relationship. You are the supervisor, you have people working under you, you should have a cordial relationship with them, you should have a policy that encourage team building and make sure that there is mutual respect for everyone at work. Then the organization could also have in place a disciplinary committee or a team, for instance, to manage and review every case of reported misconduct. A misconduct will come from the senior management, it will come from the junior staff. It doesn't matter who is involved, but the system should be able to handle any misconduct coming from aggressive manager, coming from sexual harassment, coming from egocentrism, and so on and so forth. So these are things the organization might have done to make sure that the hazard is controlled and the worker is not exposed. So if I have an aggressive manager, I should be able to have confidence that though personality, he has an aggressive personality, but because of the system in my workplace, because of the policy, because of other things that my organization has done, then I am safe working with this man and I can do my job and go home. What is the status for actions? For instance, we said you have a policy in place. Yes, the status for your policy should be closed because the policy has been designed and is in use by the organization. What are recommended actions that you can look at under aggressive manager or to control aggressive manager? You need to continually review your company policies, especially those relevant to psychosocial hazards, to make sure that they are still relevant to the present realities in your organization. Things change, people evolve, systems evolve, and so on and so forth. And your policies, your procedures, whatever actions you have in place, you also be updated to capture current realities. So carry out a review of your policies, maybe based on your document review plan, or based on urgent need, as the case may be. The date for reviewing these documents may also depend on your document review plan and so on and so forth. And who is responsible? The supervisor or the top management may be responsible for reviewing that. So, in summary, when you have this table populated, filled up, based on the hazards you have in your organization, you look at the hazard categories, fill in all the hazards that fit under each of the categories, look at how the workers are being exposed, look at what your organization has done to control the hazard, look at the status of the hazard or the controls that your organization have in place, look at recommendations that can help to improve the work conditions and the systems, look at the timelines for implementing those recommendations, and you have taken note of the action parties for each of these hazards and the recommendations. Now, this document will form what we call the hazard register for your organization, and this is a very good document that you can keep for improvement purposes and for reviewing and for updating. If you have to do if you have to design your accident prevention program, for instance, you can fall back to your hazard register and pick relevant information from there. If you have to do your job hazard analysis, for instance, you can fall back to your hazard register, pick relevant information from there. If you have to design procedures for your accident investigation, you can also look at your hazard register, pick some information from there. And if you want to determine causes of accidents, you can come back to your hazard register, look at the list of hazards you have in place, look at your training records, and so on and so forth. And these are very good ways for you to improve your overall safety performance as an organization. So, if you enjoyed this training, if you have any comments, please give us your feedback under the comment section in this channel. We'll be happy to have your feedback. We'll be happy to have your thoughts. If you have any opinion on how improvements could be made to this template, or if you have anything you feel you want to share for the benefit of the safety professionals and the workplace at large, please feel free to share. And this training has a certificate. The full training is available on our website, maranaglobal.com/shop. Go there, look for OSH hazard identification and documentation. You can register for the course and you get the full training. This is a free training. This is not required for your certification. However, if you want certification for this training, you can register for the course. Having attended this training, having listened to this material is a good way to start, and then you'll be required to take the practical assessment that will qualify you for certification. Please contact us at maranaglobal.com or using our Facebook page. Share your thoughts. Let us know if this training added value to you. Let us know if there are any way you want us to improve this training, and let us know if you want us to upload more materials on this topic or related safety topic. Thank you. My name is Yinka Fashusi from Marana Global Services Limited. Please like our Facebook page.